Over the past few months of this pandemic, many of us are tired, anxious, and confused. We've all literally been holding our breath, and we all have questions about COVID-19. Do we wipe down our groceries or not? Can we get infected from a contaminated surface? How do we see our most loved ones, our family, and our friends? Can we go to the park without a mask and walk around freely? We know that the virus is still here. The question now is, how do we live with it? Today on City Chat, Dr. Joy Walton is here to help us understand the virus so that we can use the best practices to safely live with the virus. Hi, Dr. Walton. Thanks for joining us on City Chat.
Thank you for having me.
So I just wanted to thank you so much for coming onto the show and to informing the public and like community about, current updates on COVID and maybe to ease some anxieties that some of us have. I want to start off with this question: how has COVID changed for you when it first hit in March until now? And has there been a big difference between that time?
Thanks for that question. Yeah, no, that's a great question. It's hard to believe it's been about 4 months, at least since, I was actively understanding COVID and aware of it in our community. Obviously, we know with hindsight that it was going on much before that. But when you ask that question, what's changed? Gosh, a lot has changed. Our understanding of COVID-19 has changed. Our testing capacity has changed. Our therapies have changed. The way we do PPE and our understanding of masking has changed. So much has changed, and that's a good thing. But I like to say that we're flying this plane as we build it, and I find that to be still very true. I think the biggest thing for me as someone in the medical community on the front lines is just feeling like we do have a bit of a better handle on what's going on and understanding the way this virus works, how it's transmitted, how to protect ourselves and our community. I do feel like our testing has improved drastically, and I do feel that we at least have things that we're offering. We're not just sort of shooting in the dark. So those are some positives about the good changes we've seen. I think that still we've got a lot to learn.
Yeah, definitely. I know that the first month that COVID had hit in March, initially I was pregnant, and I was one of those people where I had no idea like what this virus even was. Like we weren't even opening windows at that point. Can you talk a little bit about like some personal things that you were doing as a physician? It would just be interesting to hear.
Sure. Yeah. At the beginning, I commonly was telling my family and my friends and my colleagues, why are we playing Russian roulette with a virus that we don't really understand? With a novel pathogen. And of course, at the time, we were hearing a lot of the reports from Italy, and healthcare workers and patients alike dying, and it was very scary. So I will say that as a physician, and as a daughter, a sister, a mother, a wife, I was telling my family to be very cautious. And so at the time, there was a lot of debate. Is this a virus that could be transmitted airborne, or is this a virus that's primarily transmitted via droplets? And so as the science became more robust and as things evolved, we began to understand that primary transmission of SARS-CoV-2 is through droplet transmission. And so where that's changed my personal practice is, I don't feel as scared to let my children outside. And I have more confidence about what is considered a lower risk activity versus what's considered a higher risk activity. So I have found that, yeah, absolutely. I enjoy being outside. I let my kids play outside. We're opening our windows. But we're also taking proper precautions when we start to have issues around barriers around physical distancing and using masks in those cases.
Right. And this is just kind of a general question that I know a lot of friends and a lot of family members have just questioned the CDC and statements that have come out. Could you speak on behalf of that confusion of why people are feeling like, well, I heard that you're not supposed to wear a mask, but now we have to wear masks. Like why, like I just want to touch a little bit on like that political division and just want to hear your perspective on that.
Yeah, that's a great question. The politicization of masking has been very unfortunate in my mind because this really comes down to being united. It comes down to the public health, population health, and this virus doesn't care which party you stand for. And so I really find that to be a tragic thing. I do understand and empathize with the confusion that the public has had, because I do feel like the messaging has been a bit muddled and it could have been clear. At the very beginning of the pandemic, there was a lot of concern of the supply chains and the lack of PPE, personal protective equipment for healthcare workers. So I think a lot of the public health messaging got confusing because there was a lot of concern for the frontline workers, those first line responders, not even having just the very basics of what they needed to take care of our patients and not become patients themselves. So that, I think, did confuse the public. The CDC was, to be clear, did put out a statement very early on that if you cannot physical distance more than 6 feet, in public places, you should have a face covering. And now, as things have evolved and the science has become more robust about masking, which at the very beginning wasn't 100% clear. We had some data from influenza and other countries, but SARS-CoV-2 and masking, universal masking, has not been specifically studied. And so, but as more and more of studies came out and it became clear that universal masking was making a difference, that's when you really started to see a lot more of the public health messaging really be behind masking. And of course, the mandates have come out in different places. And so now I think that really, as a community and as a public health community, we've kind of come together on a united front and saying, yes, if you cannot physical distance, please mask.
Yeah. And that kind of goes into my next question a little bit about the if you're going to a cookout, let's say, I do want to touch on the topic of like human error. And theoretically, we can say, yeah, it's outdoors, we can go outside, and if we can stay 6 feet apart from people, since we know that people are the culprit, and it's not so much on surfaces and not through the air or whatever, but like it is really hard. I have found that, when I meet up with my friends at the park and we talk about what we're going to do ahead of time, we're all being like very careful, like we're going to be 6 feet apart. My human like tendency is to want to talk and get closer. And it's like, I can't monitor that 6 feet all the time. Like, what should we do as a community? Like, when we kind of can assess the situation and assess how we are as people, what are we supposed to do?
Yeah, I think that's a great point, and one that in our minds we think, well, we've got this, we can handle this. But then in practice and when it's actually happening, you don't realize that, this is actually quite an unnatural way to live. And this is not a way that anyone is comfortable with, that anyone is used to in any way. And so I understand that. In fact, in the hospital itself, where we have had universal masking for quite some time, we still have to remind each other, hey, even though we've all got our surgical masks on, we shouldn't be huddling if we don't need to be. We should try. And so we have to gently remind ourselves, even in the healthcare worker community. So I definitely empathize with that. What can you do? I mean, as much as you can to mitigate the risk. And as you said, planning ahead of time and say, well, look, it's time, it's space, and it's the number of people. Can we somehow, control what we can control right now or ahead of time before we enter into that activity? So for time, can we limit this, barbecue party to an hour at tops, 30 minutes, maybe, at the most a couple hours? How about space? Instead of indoor and kind of cooped out without good ventilation, could we make it an outdoor venue? And then people, remember, are the vectors for this disease. People. And so, yeah, the number of increasing people increases your chance of exposure. So, thinking about how to limit it to, the essential people you have to have, that you really want to see. And I know it's so hard. It's so difficult. And I know everybody's making sacrifices, but it's for the good of everyone.
That's great. Thanks for that response. when we take a look at masks and the different levels of protection, can you kind of walk us through cloth masks versus surgical masks, and then N95 or KN95 masks?
Sure. Yeah. So cloth masks, you've probably seen and are very familiar with. People are making them. They're on Etsy. You can buy them almost anywhere online now. And generally the recommendation is that those be at least 2 or 3 layers. And those really just serve as a barrier. Contrary to a lot of thought, there is some protection that it provides to the wearer. So yes, primarily cloth masks are going to provide protection to those that are around you, and that's what we want. We want to promote that message of, hey, do something for others. But there is protection that cloth mask can provide to the person that's wearing it. In other words, since we know that SARS-CoV-2, this virus that causes COVID-19, transmits via droplets, if someone with COVID-19 was to cough, in your vicinity, rather than those droplets landing directly into your mouth or your nose or your eyes, what we call mucous membranes, they would hopefully land on that cloth mask. So there's that. Obviously, there's the issue of fit. And I think that is something that's important. If it's ill-fitting and you're constantly touching it, that may not be as ideal. And then, of course, washing it and making sure when you wash it, that doesn't compromise the fit. So there's cloth masks, and then there's surgical masks. Surgical masks are, quite a higher grade. I mean, these are what we're using in the hospitals universally. And they work by a completely different mechanism. They're not just barrier. They're work by an electrostatic mechanism, similar to a dryer sheet in a dryer, the way a sock might stick to a dryer sheet. And so those are being used by healthcare workers. We offer those to our patients as well. And those are going to block droplets.
Okay.
So primarily are being reserved for the medical care community, although I'm seeing that more widely distributed, in the public, I think, because a lot of the PP issues have been more mitigated in a lot of places. Not all, though. There are a lot of places that are needing to reuse their masks. And then finally, the N95 is the highest grade medical mask that we use, and should, like I said, really be reserved for the medical community and only in specific situations.
Okay. Yeah, I heard from a friend who had in the beginning of March had an N95 mask, and she went to the store, and a person or someone from the store was like, kind of called her out, and she was like, you need to give your N95 mask to healthcare workers and things like that. So like there was definitely like that tension of like masks, I guess, like towards the beginning, but like what you were saying, I just bought a box of surgical masks on Amazon. Like, so it is not an issue anymore for hospitals, PPE, or is.
There are some places, some rural places, and other spots that are, like I said, having to reuse surgical masks and N95 still, which is not ideal at all. So, in general, I think the public health messaging has still been to use a cloth mask. However, the restrictions that were placed on that early in the pandemic, I think, are no longer. But at this point, yeah, facial covering is sort of the broad term being used.
I see. Okay. So we talked a little bit about masks and the new data that has come out. Is there what are just some of the basic? I mean, can we just go over the basic protection of what people should do versus people who are at higher risk?
Yeah, that's a great question. Obviously during lockdown, we were all sort of doing the same thing, right? Sheltering in place. And really, if you think about that time, obviously that was a difficult time for everyone, but the purpose of that was really to really slow down the spread of this virus, the transmission in the community that was already endemic at that time, and to allow for the hospitals to prepare for transmission and for patients being hospitalized. And so it really bought us a little bit of time to be prepared for a potential surge, which at least in Ohio never quite happened, which is wonderful, thanks to the work of Dr. Amy Acton and Governor DeWine and some of the early actions. Now that obviously everything has opened up, we're in this place where the messaging is still the same largely. Obviously businesses are running, we're talking about schools reopening and all of that, but still the message is, please, if you can, wear a mask when it's difficult to physically distance. absolutely maintain physical distancing of 6 feet. I like to use the word physical distancing so that we can remember that we can still socially engage in some ways. And then hand hygiene. Those three basic things are still the same message, and they absolutely apply to those who are higher risk in the category of older age with comorbidities such as diabetes, high blood pressure, and obesity, among other things that cause immunosuppression. So that messaging really hasn't changed. And I think that that has been what the difficulty has been as the economy has opened and the reasons for opening are understandable. We were seeing some of the ill effects of lockdown as well, from the medical standpoint, people not seeking their care, children falling behind on their vaccines, all of those things. But I think where things got confusing is, oh, the economy has opened up, everything is opened up, therefore we can let our guard down. And that's just not the case. We are absolutely still in the thick of this. Some have compared this to just maybe the third inning of a baseball game. So the messaging is still the same: physically distance, wear a mask, and wash your hands.
Would you say that we're maybe at like the fourth inning of this rather than the third?
I don't consider myself an expert, but as I've been listening to leading epidemiologists and folks that really have understood how pandemics work and global epidemics, most of the agreement is that we're still very much in the thick of this. So, people talk about the first wave and the second wave. We're still fighting this first wave. And there's growing thought that rather than sort of this first wave and the second wave, that there may be just an up and down sort of trajectory of this virus, just depending on where the outbreaks go. And the virus doesn't care. It just sees hosts.
Right. Okay. So for those of us who have found this conversation kind of saddening, is there a message of hope that you would like to, really tell and let the public know?
There's always hope. I don't think that any of us in the medical community have experienced anything like this. This is obviously uncharted territory for all of us. But in the same vein, I think about the whole world working on therapeutics, drugs to help make things better and to decrease morbidity and mortality of COVID-19. I think about the whole world working on a vaccine. It's quite amazing. It's quite remarkable. We don't hear about vaccines coming up in the market this quickly, but it is looking good, according to experts like Dr. Fauci, that we may have a vaccine by early next year, 2021, and that is going to be extremely important. There's still a lot of work to be done on safety and efficacy and eligibility, and also how it's going to be distributed, as well as the immunity. We still have a lot of questions we haven't answered about how long is there immunity to this virus. So still a lot of unanswered questions, but absolutely, there's hope. There's always hope.
Thank you so much, Dr. Walton, for everything that you've informed us about and that message of hope. We look forward to talking to you again. Thank you so much.
Thank you.
I'm Josie Smith. Thanks for watching City Chat on CTV.